10% of newborns are born tongue-tied when the thin band of tissue stays connected to the tongue, sometimes causing breastfeeding and swallowing problems. But as Lisa Guerrero reports, the American Academy of Pediatrics released a new report saying it's often overdiagnosed and treated with unnecessary surgery.
For new moms, nothing can be more stressful than getting their infant to start nursing. But what happens when a baby refuses to feed? Many anxious moms hire lactation consultants, especially if their baby has something called a tongue tie. What's a tongue tie? It's when the infant's tongue is tethered to the bottom of their mouth like this, making it harder to latch on and swallow. It can be fixed like this, a quick procedure called a tongue tie release, performed by a dentist using a scissor or tiny laser that cuts out the tissue under the tongue. Cutting babies' tongues has turned into a booming business. Many procedures cost more than $1,000. The results can be very effective, but today many experts are sounding the alarm. Is the tongue tie procedure being used on too many babies who may not even need them?
Come on.
Aubrey Nobili and fellow mom Tess Merrill say they became alarmed when their babies first struggled to gain weight.
I was so concerned about Vivi's loss with her weight that I was just desperate.
And I was growing to a desperate point where occasionally she would skip a feed.
They both turned to this woman, Melanie Henstrom, a lactation consultant.
Almost all moms want to at least attempt to try to breastfeed, and some so badly that they're willing to do anything to have that happen.
I told Melanie what was going on, and she said it sounded like a tongue tie. And she told me that tongue tie releases will fix these issues every time.
Both moms claim Melanie, who is not a medical doctor or nurse, pressured them into getting tongue tie procedures, referring them to dentists who laser cut their infant's tongue tie.
What was it about her that made you and your husband feel like, okay, we're going to go ahead and do what she says?
She had told us that we were going to have all of these problems, that Vivi was never going to be able to successfully eat or feed.
Did she bully you?
I personally felt like she bullied us, 100%.
Hi.
Aubrey's daughter Vivi was just 3 weeks old at the time.
Melanie pulls out a sound machine and she turns it on. And she says, "You don't want to hear this, so you guys will just stay right here." And I handed my baby over. And just started sobbing because I felt like I had made the biggest mistake of my life. I will never forget the smell of the burnt flesh from her mouth as she was crying.
After the surgery, both moms say things got worse.
We had been exclusively nursing up to that point. She had never had a bottle or been fed any other way. And now I was being utterly rejected. She became a baby who would rather die than eat. We were sent to the hospital because she hadn't eaten in over 12 hours at that point. At the hospital is when they said she was dehydrated and they placed her on a feeding tube.
Eleanor would never exclusively breastfeed again. Vivi still can't eat solid food. Kathy Strickland helped treat Vivi after the surgery.
I want there to be oversight for how people proceed with tongue tie releases. I want there to be accountability. Their parents have been persuaded to go this route because they thought that was the only route to go.
Aubrey and Ryan Nobili say that they are still experiencing the fallout from Vivi's tongue tie release.
Is Vivi still suffering?
Absolutely. It has completely changed the entire course of our lives. Vivi still doesn't eat solid foods, and she's 14 months old.
We spoke to Dr. Jenny Thomas, who co-authored the new report from the American Academy of Pediatrics.
The tongue tie surgery is beneficial for some patients, absolutely, but it is not always the answer.
Dr. Richard Rosenfeld is one of the top pediatric ear, nose, and throat doctors in the country.
In the right child for the right reason at the right time in the right way, you can change the life of the baby and the mother. The problem is when it's done in the wrong child for the wrong reason, and the wrong reason can sometimes be profit-driven.
Lactation consultant Melanie Henstrom did not respond to our request for comment. She recently closed her business, writing in a post that despite positive feedback, a few unhappy individuals have tarnished her reputation.